Welcome to yet another episode of a program, Goals for Change. My name remains Osiyoyi Oluwaseun. On today's episode, we'll be looking at the activities of Abuja Enterprise Agency as it relates to the SDGs. We will be right back.
It's no news that we are faced with a deadly health challenge called coronavirus, also known as COVID-19. Coronavirus is an infectious disease from a large family of viruses that are known to cause illnesses ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). You can contract the virus when you come in contact with the droplets of the saliva or discharge from the nose or mouth of an infected person when they sneeze or cough. Symptoms ranges from fever to cough to shortness of breath and breathing difficulties, pneumonia in severe cases, kidney failure in severe cases, and even death, especially of the old and those with underlying health conditions. Be properly informed, especially as to what to do, where to go, and who to call in case you suspect a coronavirus case around you. Always wash your hands with soap and water or sanitize your hands with alcohol-based hand sanitizer. Do not touch your face. Be conscious of yourself. Do not touch your nose, eye, and mouth. If you want to cough or sneeze, do that into a flexed elbow. Always cover your nose and mouth when coughing and sneezing with tissue or a flexed elbow. Always ensure that your meats and eggs are thoroughly cooked. Eat nutritious food to boost your immune system. Always avoid contact with anyone with cold or flu-like symptoms. Always avoid unprotected contact with live, wild, or farm animals. If by chance you come in contact with them unprotected, ensure you take a thorough bath before you proceed with other activities. Coronavirus has no known cure at the moment, so to stay safe, stay home, and if you must go out, maintain social distance and ensure you wear your face mask or face shield and sanitize your hands properly. The responsibility of your health and that of everyone around you lies with you. Do your part to curb the spread of the virus and stay safe. We can tackle the spread by sticking to the rules, especially washing of hands, using the face masks, and keeping out of crowded areas. Please do not stigmatize. Let's stay safe and keep watching Goals for Change. This message is brought to you by Goals for Change.
Welcome back. On today's episode, we'll be discussing with Dr. Mohammed Arabi, Tukur, the Managing Director of Abuja Enterprise Agency. Prior to this position, he was the Deputy Director, Establishment, FCT Administration, and also the General Manager, FCT Community and Social Development Projects, a World Bank program. He is a development strategist and a technocrat. Stay with us. We'll be right back.
The Abuja Enterprise Agency is a special purpose vehicle for the development and promotion of the micro, small, and medium enterprises in the FCT. For those who may not know the agency is an agency of the FCT administration. It was established in 2006 with a clear mandate to create jobs, to generate wealth, and to a large extent reduce poverty in the FCT. So far, so good. In the last 14 years, the agency has been doing its best to achieve this core mandate of poverty reduction. And in doing so, we came up with different models of projects, which includes trainings, supports in terms of business advisory, supports in terms of access to finance, building the capacities of the clients that we interface with, as well as our own staff. So far, we were able to generate over 150,000 jobs between that period to date. And in 2016, the agency took a paradigm shift by developing a strategic plan that can last up to 2023, where we expect that by 2023, the agency is going to create 230,000 jobs in the FCT. This falls in line with the principles and dreams of the administration of President Muhammadu Buhari for creating 100 million jobs for Nigerians in the next 10 years. The agency's mandate clearly falls within the goal 4 of the SDG, which is poverty reduction. And from what I have told you earlier, you can believe me that we have been trying as much as possible to gain milestones that can reduce poverty in the FCT. Our programs are tailored towards the rural community areas in the FCT. You may not know, but let me tell you that the FCT, as it is, has over 900 communities in the 6 area councils. The urban centers that you see in the FCT are just about 24. And over 800 communities are in the rural areas. So our focus is to ensure that these rural communities are developed in terms of business, so that the livelihoods of the residents in the areas can be upscaled to ensure that people live happily, security is available, food is available, and everybody is happy. What we did in 2016 after developing a strategic plan is to ensure that whatever program or activity we intend to give out to the residents of the FCT, 70% is for the women. We deliberately did this because we realized that it is the woman that carries the burden of holding the family, not the man. We made a survey in 2015 to know amongst the 2 genders, male and female, who are most responsive when it comes to financial management. And we realized that the women are much more responsive when it comes to managing the funds. We also conducted a survey to see if a man is given money to start a business, and a woman is also given the money at the same time to start the business, who pays first? And the women pay much faster. So we decided that going forward, whatever we are going to do, whether it is a program, or it is a project, or it is a training to build the capacities of people, the women take the chunk of 70%. And it has been very successful. The response from the women of the FCT is so exciting that when you go to areas like Abuja and you start talking to the women, they will tell you, we know it, and we've been taught this and that. All we need to do now is to be brushed up. So in terms of gender equality, we took a bold step to ensure that the word of equality is not applied as it is supposed to be. We decided to tilt it much more towards the women than the men. because the women are much more vulnerable when it comes to holding the family. The women are much more vulnerable when it comes to gaining access to basic amenities. And the woman is much more viable when it comes to doing the business than the man. Of recent, we've started discussing with the Agricultural and Rural Development Secretariat. We realized that we have not been carrying along the objectives of providing nutritional services to the women. While we are doing the business angle, we have not been looking at the possibility of giving them food to eat or quality food to eat. So we decided to speak to Agricultural and Rural Development Services Secretariat. The discussions are on. Just recently, we requested for a parcel of land where we can develop foods like cereals that can be harnessed and be given out to the women in the rural areas. And we also want a situation where the farmland is divided into parcels, where we bring in the women as well as the men to come and cultivate some kind of food crops that can build the health status of both men and women in the family.
My name is Dr. Babagana Adam. I'm the Director, Department of Outdoor Advertisement and Signage. Keep watching Goals for Change.
Dr. Ndayo Iwat, I'm the Acting Executive Secretary, FCT Primary Health Care Board. Keep watching Goal for Change.
It's so exciting to hear that Nigeria turns out over 1 million young men and women at the end of every year as youth corpus. And in so doing, we decided to partner with the NYSC so that at any given point in time, when the youth corpus will be in the camps, we go there, we train them on the various skills, and it is as a result of that NYC came up with a program called SAID. SAID program is a program where the talents of the youth corpus are looked at from the point of their being in the camps before they even come out from the camp. Some of them, you find that some of them, before they even come up from the camp, they have started doing their own businesses. I can give you so many examples. There's one young woman, she started from the camp. Today, she's a household name in rug making. This rug that you see right in front of us here was made by her. So that's what we do to ensure that the youth corpus that come out from the universities are not wasting their talents when they are in the streets. And we'll continue doing that. Absolutely, it can, but on a good reason that the agencies that are supposed to turn out the results of the SDGs and the 2030 vision are not working in silos. By so doing, we must work in a synergy to ensure that what agency A is doing is not replicated by another agency, which will bring out duplicated roles. if SMEDAN is going to work with the Abuja Enterprise Agency to ensure that ABC is done, SMEDAN and AEA should be able to sit down to say, okay, we are going to do this, you take this role, we take this role. At the end of the day, this is the objective. But as long as the agencies are going to work in silos, I have this fear that the objectives of the SDGs and the Vision 2030 may not be achieved. But if synergy is created, I want to assure you that the target is not only going to be achieved, but it will be surpassed. Usually the challenges that we face is not far away from the attitude of our people. It's not as if the resources are not there, but people are not willing to find ways of accessing the resources. Nigerians, particularly our young people, are more or less, I don't want to use the word lazy in going out to look for what they're supposed to look out for, but they always want things to be given to them on a platter of gold. You don't expect government to follow you up to your bedroom to give you money to go and do business. You have to start something, initiate something, and the government give you the support. So the challenge is more or less attitudinal. When this mindset is changed, definitely the challenge will not be there. CBN has been given a lot of windows for the MSMEs. Between January to date, over 7 different types of windows are lying down there. But if you conduct the survey to find out how many people were able to access these windows, you will find that the numbers are low, because people are waiting to be begged to go and take it. But if you do it and you are committed in doing it, you will get it. And you don't have to know anybody before you access that. So largely it's about the attitude. Once this attitude is going to be changed, I want to assure you that Nigeria is going to be better than what it is today.
It's no news that we are faced with a deadly health challenge called coronavirus, also known as COVID-19. Coronavirus is an infectious disease from a large family of viruses that are known to cause illnesses ranging from common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). You can contract the virus when you come in contact with the droplets of the saliva or discharge from the nose or mouth of an infected person when they sneeze or cough. Symptoms ranges from fever to cough to shortness of breath and breathing difficulties, pneumonia in severe cases, kidney failure in severe cases, and even death, especially of the old and those with underlying health conditions. Be properly informed, especially as to what to do, where to go, and who to call in case you suspect a coronavirus case around you. Always wash your hands with soap and water, or sanitize your hands with alcohol-based hand sanitizer. Do not touch your face. Be conscious of yourself. Do not touch your nose, eye, and mouth. If you want to cough or sneeze, do that into a flexed elbow. Always cover your nose and mouth when coughing and sneezing with tissue or a flexed elbow. Always ensure that your meats and eggs are thoroughly cooked. Eat nutritious food to boost your immune system. Always avoid contact with anyone with cold or flu-like symptoms. Always avoid unprotected contact with live, wild, or farm animals. If by chance you come in contact with them unprotected, ensure you take a thorough bath before you proceed with other activities. Coronavirus has no known cure at the moment, so to stay safe, stay home, and if you must go out, maintain social distance and ensure you wear your face mask or face shield and sanitize your hands properly. The responsibility of your health and that of everyone around you lies with you. Do your part to curb the spread of the virus and stay safe. We can tackle the spread by sticking to the rules, especially washing of hands, using the face masks, and keeping out of crowded areas. Please do not stigmatize. Let's stay safe and keep watching Goals for Change. This message is brought to you by Goals for Change.
Like I said, the most important thing is for all agencies that are having the responsibility of delivering the mandate of building this country to work in synergy. That's the most important thing. It's not as if the strategies are not there. The strategies are well captured. They are well in place. They can be implemented very well. But as long as they are being implemented in silos, the rate of achieving the goals will be very minimal. But once we put our heads together and work as a group, we'll achieve that. Ever since the creation of the Abuja Enterprise Agency, we've been having the children at the back of our minds. This is why we created the Entrepreneurs Club. This club exists in all the secondary schools in the FCT. And in 2016, we decided to also come up with another initiative of having the summer camp, where when children are in long vacation, we bring them to the Abuja Enterprise Agency. We put them in a classroom. We train them on entrepreneurship skills. We make sure that we occupy them throughout the period of the long vacation. And I want to believe agencies like SMIDAN, NIDA, NEPC, and similar agencies like ours do the same. So for Abuja Enterprise Agency, we have not just started it. It has been there for over 10 years now. The clubs have been in existence. And we did not only restrict ourselves to the public schools. We have gone down to the private schools. Of recent, we did one in Kubwa. It's a private school. And we ensure that the club is created. We ensure that membership of the club is gingered to ensure that they know what it is all about, and we support them.
My name is Dr. Babagana Adam. I'm the Director, Department of Outdoor Advertisement and Signage. Keep watching Goals for Change.
Dr. Ndayo Iwat, I'm the Acting Executive Secretary, FCT Primary Healthcare Board. Keep watching Goal for Change.
We have come to the end of today's episode of the program, Goals for Change. You will agree with me that achieving these goals is our collective responsibility. Therefore, all hands must be on deck so that we could make our world a better place. And remember, COVID-19 is still much around us. Maintain good social distance, wash your hands regularly, and use your face masks to curb the spread of COVID-19. My name remains Oshiyoyi Oluwaseun. Keep watching Goals for Change.